Hello and welcome to the third annual Payer Provider Virtual Summit. I am Kyle Murphy, Vice President of Editorial at Xtelligent Healthcare Media and moderator of today's session, Data-Powered Strategies for Improving Consumer Experience. Before moving on, I'd like to thank our sponsor. Redpoint Global was founded in 2006 by a talented team of pragmatic technology innovators experienced in solving customer engagement challenges across data, insight, and actions. Today, Redpoint's leading data management and customer engagement solutions are trusted by renowned brands to deliver highly personalized and contextually relevant consumer experiences that positively impact business outcomes. So today's session will take the form of a panel discussion with our speakers, followed by a Q&A segment with our audience. Audience members can submit questions at any time during the session using the question and answer box on the left-hand side of their screens. A recording of this session will be made available later this week. Today's session will play via your computer speakers. We do not have a dial-in for today's presentation. If you experience technical difficulties, please try refreshing your browser. For all the technical matters or difficulties, click the help icon at the bottom of the screen. Now with that, I would like to introduce our panelists for today's discussion. First off, we have Shri. Shri, welcome, and please introduce yourself.
Thank you, Kyle. Good afternoon, good morning, everybody. Sri Krishnamoni, I'm a partner with PwC, and I work in our customer transformation practice. A lot of the work that I do is focused on helping healthcare organizations drive forward their patient experience and consumer experience agenda. And I work at the intersection of technology and operations. I've spent quite a bit of my career in healthcare. So happy to be on the call and look forward to this conversation today. Craig?
Yeah, thank you. Hello, everyone. Craig Thomas, CEO and co-founder of Lucerna Health. We work with healthcare provider organizations to help them grow, engage with their patients, and work with payer partners. We work in a lot of joint ventures, integrating processes to improve performance and value-based care transformation. And before that, I was with Guidewell, Florida Blue for many years, so we have a lot of experience on the payer and the provider side, and we use Redpoint's software within our platform to help with patient experience. Happy to be here.
Excellent. And Chris?
Yeah, hi, I'm Chris Evangelidi. I run our healthcare practice at Redpoint Global. I've been here for 9 years, and Redpoint's been really in the healthcare vertical for 7 of those 9 years. Prior to that, I was in the kind of the technology financial services space. And then, so right now what we're doing is we're working with large payers, providers, and life science companies to help transform the customer experience, however you define the customer, whether it's a patient, a member, or an HCP.
Awesome. Well, welcome everybody to the panel. And let's move on to today's discussion because we've got a lot to get through. Shri, we're going to start with you. What are the current economic and really the strategic drivers that you see are shaping the healthcare industry today?
Interesting question, Kyle, and maybe I can give the audience a little bit of what we are hearing from our clients, right? Especially the healthcare clients that I'm serving. When I think about that question, like 4 sort of broad imperatives and trends come to my mind. I think first and foremost is the fact that I think the way consumers access healthcare has shifted, right? Consumers are much more sophisticated. When I think about, my generation, I guess, my parents' generation, and how we approach healthcare, I think there was a lot of emphasis on quality of care. That continues to be the case, but there's also an equal emphasis on both affordability and convenience, especially we live in an era of high deductible plans where cost is a big focus and access to care is becoming a critical issue. So I think offering affordable, convenient care with high quality is becoming an imperative. As an example, like we've done a lot of analytics, and one of our insights show that for health systems especially, if you're going to make a patient wait for more than 7 days for an appointment, chances are that that patient is not coming back, or they're not going to, take the appointment, or they're going to reschedule or be a no-show, right? So I think that's becoming very important. I think the second big shift, I would say, which has been occurring in our industry for a while, is the continued shift to value-based care. We're going to see more and more of that. I think Medicare will probably lead that space. And as you think about value-based care, then I think care model innovation becomes very important. So how do you deliver care, not just focusing on episodic care, but how do you deliver whole person care that is across settings, right? So that's in the outpatient setting, the acute setting, and even at home. So I think there's going to be a lot of innovation in the care model that will need to take place. I think the third thing a lot of our clients are trying to address is, and we've all experienced this during the pandemic, post-pandemic, is a staffing shortages, right? So I think it's going to be more and more critical to address that. If you think about healthcare in general, a lot of the labor costs really form highest OpEx for a lot of the organizations, right? So being able to drive utilization and so that you're more profitable and also alleviate the burden for the clinical staff is going to become more important. I think all of this to me is really setting up the fundamental question for healthcare in terms of how do you create an ecosystem that is really driving and going beyond episodic care, going to managing health and well-being of the patients and consumers, and doing that in a way that is convenient, that is high quality, and at an affordable cost.
Excellent. Chris, let's bring you in here. Can you tell us, what are U.S. healthcare consumers saying, and why is it important to payers and providers?
Yeah, so prior to the pandemic, Redpoint commissioned a survey with a research firm to survey the U.S. health consumers. And then post-pandemic, or as we're coming out of the pandemic this September, we issued the same survey. So I just wanted to throw a few stats out here for the audience, and that is the top line message here is that 75% of the U.S. health consumers wish their healthcare experiences were more personalized. And of that group, there's 50% would leave their provider if they have a bad patient experience, and then 81% say their overall experience as patients and members is very important. So the concept of experience, patient experience, member experience, that's table stakes now. If you're out there and you're not focused on experience, then there's I think there's going to be issues there. Having said that, there's some interesting data within the data, and that is there's been a growing desire by healthcare consumers to have proactive engagement with providers and payers. Our surveys show that 45% of the patients expect healthcare brands and providers to proactively contact them at the right time and in the right context for their healthcare journey. And then 41% of them would consider switching their healthcare plan and provider due to poor customer engagement. So it's different than service. This is poor customer engagement. And 38% would switch due to lack of personalization or patient understanding. So the healthcare consumer is starting to act more and more like the other consumers in other areas of retail and financial services, where they're used to this frictionless, proactive experience, and that takes their journey along in a way that's valuable and meaningful to them. Now, the good news is for those healthcare companies that invest in this experience and invest in proactively engaging with the patient, 64% of U.S. health consumers would choose their healthcare provider or payer based on their ability to communicate in a timely and consistent manner. And I think this is all really becoming super important, because when you look at the total amount of time, and I just heard this stat here recently, I came off the Health 2022 conference, but the average U.S. health consumer in a year spends about 6 hours in front of their doctor or care teams. That's the average. Chronic obviously is higher. But when you consider 6 hours out of a year to try to deliver a great health experience, I think what we're seeing is that, patients and consumers want us to extend that experience from the face-to-face hospital setting to outside when we're away from a hospital setting. So that's what we've seen so far from a U.S. health market consumer standpoint.
Excellent. All right, Craig, next one for you. What are the challenges and gaps you see in delivering a superior personalized patient experience?
Yeah, there's a lot you can say about that. First of all, it's maybe to say a couple things that are probably obvious to everybody. Consumers vary quite a bit based on culture, health conditions, age, where they live, and all kinds of things. And so what people are looking for in experience is different. I guess that's why you have the personalized part of the question. And healthcare, I operate pretty close to the operations of things. It's a very complicated, fragmented, challenging ecosystem or environment to operate in. And so I think you have to start with that. The healthcare system itself creates quite a bit of challenges. Plus, people are sometimes sick and challenged in whatever's going on in their lives. But with that backdrop, I think the first one is actionable insight. And that's not data. That's working with the data to pull out, actionable insight that either management or frontline staff can use to deliver that experience. And the goal is to have a great experience at every single touch point, not just when the person's, as Chris said there, in front of the care team for 6 hours a year, but it's when they interact with the websites or, other providers within the ecosystem or the call center and all those kinds of things. So you've got to get that insight moving throughout the system. And I use the test. If an operator appreciates the insight, can actually use it in their day-to-day work, then that's pretty good. The second one is what can management do with it? If patient-centered care, patient experience, patient retention, loyalty is important to them, how well do they know what's working and not working in their company? At the process level, at the provider level, at the facility level. So you have to produce, measurable dashboards and so forth that are relevant to management. I'd say the third one is you've got to connect it somehow to workflow. If you have let's say a customer 360, but your providers don't know at point of care, your call center reps don't know, your check-in staff doesn't know, and then you've got your ecosystem outside of your company, the referring physician, the specialists and so forth. So getting that to your ecosystem is a big challenge. And I would say the last big one maybe to just mention is a softer one, a more illusory one, or elusive one is the mindset. Is it a consumer mindset? Is the culture really care about it? Does the staff have training and people skills? I can get into this a little bit more in a minute because I need to stop here. But if you can improve the doctor-patient relationship, which is all about these types of things, there's a lot out there that says, hey, you're going to get better outcomes, better health outcomes, and better business results if you're a provider, particularly in value-based care. And I'll add some comments maybe if there's a chance later on how value-based care impacts this topic.
Kyle, I think, I just wanted a couple of points that Craig made resonated with me, right? I think when I think about driving a better patient experience, right? Oftentimes we think of it in terms of technology, right? But it is really the intersection of technology and operations and operating model, right? As an example, if you're trying to improve access as a health system, right? Obviously you need the insights. You need to be able to create a good digital front door experience, but at the same time, you need to create the capacity in your organization to have the appointments, right? So for example, a new patient appointment is available. So when somebody does come through your digital front door, they not only get a great web or mobile experience, but they're actually able to book an appointment because that's what gives you the best experience, right? So it's a combination of all of those levers that I think become very important in driving a transformation.
Yeah, and that's a very good follow-up, Sri. I think I'll follow up on your follow-up, and that is how do you create that capacity in a shortage of doctors and nurses, or where you're having a lot of turnover here. And what we would say is you can start to really hyper segment your patient population so that you're prioritizing those that maybe have the highest chronic conditions or the ones that maybe have the the greatest value-based payments, where there's the greatest risk for the health system. And through that prioritization, then you can schedule it based off of that. And then from there, what you have is your leftover capacity that you can take in on your onesie twosies that maybe don't fall under in that. But that's one of the techniques. I know, Craig, you guys do that quite a bit with your practice as well. So that whole operational sensitivity is really critical. And I'm glad you brought that up, Sri. It's absolutely true. And there's ways to do it without having to continue to add capacity. We kind of have to think about how we have to do it smarter, basically.
Agreed.
Excellent. Sri, let's come back to you. How big of a threat do you think, big retail, the Amazons, Walmart's, Targets, are to traditional healthcare providers and insurance plans? And, what would you say are the steps that healthcare organizations need to take now to really strengthen their positions as conveners of care?
Another great question, Kyle, right? So I guess the first thing that comes to my mind when I think about Amazon, Walmart, Target, I think first and foremost, they don't operate as traditional healthcare organizations do, right? I think they have historically always put the consumers first, very consumer-focused organizations. And that's kind of how, if you were to think about it, their DNA, right? That's how they're built up. If you consider what Amazon is doing with the acquisition of One Medical, or CVS is doing with the acquisition of Signify, I think what they're essentially betting on is a care model that is able to extend care delivery options, to a consumer or a patient based on their needs, right? So they can get a care at an outpatient setting, or they can get care delivered at home. And with some of the logistical capabilities that their organizations have, I think that gives them very good synergies to try some new things in the market. Having said that, I also feel like when I think about your other part of the question, like what should health organizations do? Health organizations also have some great assets, right? When you think about care delivery, it's not just home-based care. It is, acute care, it is critical care, it's specialty care. And so it really requires a integrated care continuum to really serve a patient, especially when you're moving more and more to risk-based models. And I also think that, competition in a way in the future is not necessarily going to be between one entity or the other. It'll be with ecosystems, right? So there'll be health ecosystems that will continue to emerge. And in that, you have to sort of think about what your role is. Are you playing a care orchestrator role where your primary focus is care coordination, delivering a great experience? Or are you going to be a care, integrator, right? Where you do that, but you also take on risk, whether that is through bundles or capitated payment. Or you might become more of a platform player where you're essentially providing a clinical service or an administrative service or a technology that solves one piece of that whole value chain, right? So there are multiple ways in which the market, and quite honestly how you serve that market, can evolve. But I guess they're fundamentally going to require a few capabilities, right? So when you think about capabilities that you need to be more consumer-centric, I think first and foremost, I would say maybe 3 or 4 things, right? One is what I was mentioning earlier, just have the consumer be the focus, right? How do you go beyond transactional care or episodic care to really building loyalty and retention? And in that, when I say consumer, I don't just mean the patients, but it's also putting your clinicians, your employees at the center of that journey. Because being able to deliver a great experience, you also need to make sure your employees have a great experience. So I think that's important. A lot of the organizations, and this may be a concept in retail that could be applied in healthcare, this concept of know me, right? How do you build a 360-degree view of your consumer, that you know them, you know their needs and wants? And that's just integrating not just clinical data, but non-clinical data as well, potentially social determinant data, economic data, other kinds of information. I think the second critical capability or emphasis, I would say, is just driving more innovations in care model. We saw that during the pandemic, right? When the pandemic occurred, a number of organizations very swiftly adopted virtual options. And even in my household, like, for about a year and a half, with my 2 daughters, right, I was able to do a lot of visits with my pediatrician just over video, which a few years ago, that would not have been the norm, right? So now I think that is an opportunity, I think, to drive innovative care models through the use of virtual care or remote patient monitoring, and then really integrating that home-based care into your overall care offering, right? I think that is a second focus, I would say, that organizations must do. And the third, I would really talk about is how do you build partnerships in the ecosystem. So in the new model, I don't think you need to necessarily think of delivering everything yourself, but how do you build the right partnerships? Whether it is looking at insights and looking at social determinant data and determining that somebody is going to need a higher degree of care at home from a dietary perspective, or addressing a food insecurity after they've been discharged from an acute episode, or essentially learning that somebody might need transportation assistance, right? I think all of those will matter, and those will require insights. They will require different ways to deliver care, and they're going to require different partnerships. So I think that, to me, is an opportunity. I think it's an opportunity for the healthcare organizations to kind of look in that direction and determine how can you be more consumer centric.
Yeah, I think.
Yeah. Go ahead, Craig. Yeah.
Oh, sorry, Chris. Just to add in, I think we all know that healthcare is a gigantic industry that is ripe for disruption and needs transformation, which is fundamental change. And that's what value-based care is. That's what the move to patient experience is. So I wouldn't bet them out to have a place in that industry. They have some advantages: the footprint, consumer mindset, capital, customer relationships, data, insight. They know how to work with it. They know how to communicate effectively. So they have I think, probably a good place, and I wouldn't overly underestimate them, I guess. The flip side is where the system really needs to work better is with people who have health conditions. That's where the costs are. That's where the high need patients are. That's where the coordination is the most. Not to, minimize wellness and so forth too much, but and that's where I don't know that retail-y, episodic kind of thing has much of an impact. So if the core healthcare industry can take the strengths that it has and transform towards value-based care and patient centricity, and learn from retail, I think the future is pretty bright for those companies who can make that transition. Which, if you look at the history of business transformation, it's companies aren't always successful with that kind of change in their companies.
Yeah, I would add that, it's not just Amazon and CVS that are entering into the healthcare space. At Health, I was speaking to grocery chains and things like that. So I think what's going to happen is this whole mindset around the customer experience and the ability to leverage data and analytics in a healthcare setting. That is really where it's going to, the consumer expectation, whether they're going, from a specialty or value-based care, what the Amazons and the consumer type companies that are coming in, they're going to raise the expectations. So at the Health 2022 conference, they talked about the investment in healthcare in 2021 for digital transformation. They said that the equity firms and the VC capital that went in 2021 was such a great amount of money that they cut off 5 years of digital transformation in the healthcare space. So we accelerated it by 5 years. So that's, I think, is also good news. So we're getting ready to compete in a new way, but we need people for that. We need people with the consumer mindset, because right now it's not just, when you can put the tools in the hands of healthcare professionals, but as Craig said and Sri said, if you don't have a consumer mindset where you know how to put the patient or the consumer at the very center of what you do as a business, then you may struggle. So you're going to want to try to look at, maybe hiring outside of the industry, taking on some people in retail and financial services. I know we see that with some of our larger accounts, people that have less healthcare experience and more data analytics and engagement and CX experience. And you see that in some of the titles in healthcare now. You have chief experience officers, chief digital officers. So I think there's a lot of good news coming, but we've got to execute for sure.
Certainly. Craig, you've teased the value question, so let's get to the value question. So, what are the value drivers for healthcare providers and payers today? And then how are the technological advances supporting the value-based care model, or really models, plural?
Yeah. So the value drivers are, I think, well known, and they present themselves in value-based contracts with the performance metrics that drive payments. So the idea there is to align the incentives to those things that are viewed as important by the government or the payer typically. And, we know what those are: quality outcomes, and there's a series of measures for that, lower costs, both medical and then for the provider, administrative costs. There's a big challenge that kind of sometimes doesn't get emphasized enough, and that is the productivity and efficiency of the provider operations in this environment. Because value-based care and some of the patient experience programs require resources, and you need to have your economics lined up to be able to do that. It's a practical, it's a real world thing. And then, better satisfaction. Most businesses want to grow. That's very important. And to do that, you need to have a good reputation in the market. Everybody's Googling up your performance. And you need to have provider satisfaction. And I think part of this whole issue around patient engagement, the exact same principles apply to provider engagement. Because of the shortage that Shree's mentioned, because of the turnover, because of the retirements, the burnout, if you can't kind of close that loop, what happens is the business value created from all of this slips away to, say, recruiting costs and training costs and starting all over. And so that's why I think it's important, if you're looking at patient experience and how that helps drive value, you have to look at the big picture and not some of these narrow point solutions or small projects that fix one piece of that loop of, acquire the patient, engage the patient, engage the provider, measure performance, and that whole loop. Now, that's a lot of things to do, and it is impossible to do it without the right technology platform. And that's everything from data management and analytics to process integrations to digital channels. And then on the provider side, it drips into care management workflows, connectivity with the electronic health record. And so this notion of a, let's call it IT architecture, and how all of those pieces fit in, which can be very expensive. And what I've seen a lot of is a lot of investment in the straight tech, not so much in the process and adoption and training and so forth. And then people are disappointed that the technology is not some type of miracle cure, for delivering experience and value. So there's challenges all throughout here, which is why I always say, if you're sitting in a company that's, let's say, a healthcare delivery company, and you're proud of your providers and the care you provide to your patients and community, but you're saying, hey, we need to change and get a little bit better at this piece. If it's not viewed as a tier one leadership initiative, looking at a multi-year plan, it's probably not going to have the kind of value for your company and your patients that you want. So it's a long journey, and we've seen it, and we've seen companies succeed and companies struggle with it.
Excellent. Chris, let's move on to some of the technology investments. What are some of the big ones that you've seen in the healthcare market? And then, what are the capabilities needed to engage healthcare consumers on a really personal level?
Yeah, so we have, when we go through our, client engagements, we have a few imperatives. Sri talked about some of them, but, really imperative number one for us on the technology side is you have to bring all the data together, and you have to make it fit for purpose. It's not enough just to throw it into a data lake. You actually have to be able to activate it in a way that can drive value across your health system or your insurance company. So, from that standpoint, we think that, taking that we know that we have very siloed data on the business side, but there's also siloed data on the engagement side, right? We're engaging is, the average healthcare company has 6 to 20 different engagement systems that are producing data off of the patient. So Sri talked about bringing the clinical data in with the consumer data and the social determinants of health to make a complete, robust golden record. We would say that data environment is and stitching all that data together is a foundational capability that you would need to invest in to try to get to the other capabilities that we're talking about. So number one would be customer 360 initiatives. Well, there's also customer data platforms. That CDPs are a new buzzword that's out there. So anything that you can do, invest in to bring all your data together, make it fit for purpose, and get it to be actionable so that the business can consume it or get access to it and as quickly as they need it to deliver a better experience. The second thing is we talk about connecting all the technology. I mentioned in 2021 the investment in all this digital front door and transformation in healthcare. Well, that's created a lot of fragmentation on the digital side. So what we would say is you need to invest in some sort of orchestration engine that can plug into these systems that are engaging your patients, and so that you can remove the friction as they go from one channel to another. And then the third thing we talk about is being able to operate at the speed of the patient, right? We're over 60% of the U.S. consumers are always on and readily addressable with our iPads and smartphones. So we need to be able to know digitally. We need to be able to recognize who they are, and we need to be able to carry that journey seamlessly as they interact with us, pop in and pop out. So that's also identity resolution, being able to identify, your members, your patients in all the different ways outside of the name that they come in at you. And then, the other thing we talk about is, you have to be able to personalize at scale. So we see a lot of people investing now in personalization engines, next best action engines with machine learning and AI. You've got that both on the clinical side, and then you see that also on the patient experience side. So being able to deliver personalized web experiences, Craig talked about, being able to have email and web and phone and call center and app, all that work really together seamlessly in a personalized way, so that you're giving them personalized experiences that they're looking for. It's the right message, the right time, the right channel. So those are the big technology investments. Lastly, I'll say that Gartner wrote some excellent research prior to the pandemic and during the pandemic on the three generations of healthcare engagement. And really, most of us are in kind of generation one, where we're kind of wake up, patch up, and catch up. We're very, kind of channel specific. But they say for generation two, what we need to invest in as a healthcare technology program is a healthcare customer engagement hub. And they provided that framework in their research. You can look for it online, 3 generations of healthcare engagement. But it's the same paradigm. It's very advanced data and analytics capabilities that then move into ways to activate that through machine learning and AI, and then you're orchestrating that journey or that activation in a seamless omni-channel experience fashion. So those are the big ones that we're seeing from a Redpoint perspective, and I think they're relevant if you're focused on patient experience or member experience. At the end of the day, what we have is clients that are putting the individual at the very center of what they do and building around their capabilities and programs around that.
Sri, let's come back to you. What does this transformational journey look like from an overall program perspective? And secondly, who needs to be on board to make this happen?
Yeah, I guess, I would say that the beginning point, and we have had this theme emerge in this conversation, I think the beginning point of this transformation is really to put your consumer at the center of what you're doing, right? Whether that's a patient or a clinician or an employee. I think some of the paths that some of our clients have taken is to define that and really anchor on a consumer vision and begin to sort of illustrate who you want to be by potentially, developing an end-to-end journey. Like, what is the journey for a consumer or a patient when they, sort of are researching care options, they're examining what their options are, and then they're accessing care. What does that experience for that first visit look like? How are you then ensuring that you're continuing to stay, for example, sticky with that patient and caring for them and going more into care management so that you're really treating them, end to end. So I think journey design helps quite a bit in terms of lending clarity. The other thing that I would say is it's important at the beginning as you're thinking about the journey to prioritize use cases based on the value they can create for you as an organization. We talked about value a little bit in this conversation, but whether that value comes from growth, as an example, you might decide that you want to invest in attracting more new patients because volume growth is an easy way to actually justify investments in digital technologies, or it could be improving access, right? So those are a couple of use cases that are very clearly delivering value around growth and have a clear economic imperative. Or it could be in terms of outcomes, right? And managing care, especially as you're going to more risk-based contracts, I think closing gaps in care becomes important. So there are a number of use cases in that area that are critical, especially to the point that Craig made. If you're, really treating chronically ill patients, diabetic patients, then active care management is necessary, and a lot of digital tools can help there. Or it could be efficiency, right? You're really trying to drive improvement in the way you're utilizing your resources. But I think it is important as you design that end-to-end journey and clarify the use cases that you're going to deliver, connecting them to value so that, you're able to get the support. You also asked the other questions around in terms of who you need. And I think it's critical to have your cross-section of your leadership, I would say, within the organization, not just technology, but it's your clinical leadership, it's your frontline staff, it's your marketing team, it's your contact center service team, it's your access team if you're a healthcare organization. It's really critical to have all of them. And I think bringing them through a journey design exercise is a very good way to sort of drive alignment, right? And once you have that alignment, then you can really be clear on what capabilities are needed. And those capabilities, to the example that I pointed earlier, they're not just technology capabilities, but they're also operational changes that you'll need to make to drive a transformation. So I think all of those are critical. The other point I would make is a couple more things, right? One is as you think about investments and the point that Chris was making around technology, there is this trade-off you'll need to answer around, like, do you continue to invest in siloed solutions, or do you really build an integrated platform, digital platform for engagement? So I think that's critical, right? And the second thing I would say is just take an iterative approach to building and deploying and testing things in the market. You don't have to build everything once, but focus on the high value use cases, deploy them, gain the support, and then build some agility muscle in the organization to deliver in a more iterative fashion.
Yeah, I think, Sri, you're right on that. I mean, we with our clients, what we do is we'll start, with making sure that the enterprise, it's an enterprise solution. So everyone that the use case is touching, 100% has to be on board. Everyone understands that this is a crawl, walk, run type of program that's multi-year, and that, you're starting out, really the year one ROI has to be there, right? So we're getting early returns on some of the use cases, and we're expanding across the enterprise. But we start with this strategy, right? And that's where we're bringing in folks like PwC, because they're so good at setting the strategy with the leadership team. Same thing with Craig and Lucerna. And then once you deploy, then there's this enablement phase where you have to enable, because this is all new stuff to your clients. So you have to enable them to the point where they're able to get to, to be able to run these programs on their own. So it's a very in-depth thing. It does require it to be a top board initiative, and it requires strategy, deployment, execution, and enablement services all the way through until you get it right.
I agree with you guys, and I always kind of start my thought process with kind of a company level transformation, and you almost have to put the CEO and the board in the center. But just so it's not just that kind of view, if people are out there saying, oh my God, how am I going to, get around all of this? You can make a lot of progress operationally if you know where your problems are. So for example, we run surveys that identify at a very granular level customer feedback, as I said earlier. So you can look at which medical center has a problem, which care team has a problem. Is it the billing? Is it the referral process? Is it the communications process? And you can very quickly, while you're working these other things, get a hit list of, hey, these are pain points. And I'm measuring and I'm making changes, whether it's training or process changes or whatever, that are more quick hit. And you can start improving experience right away. And that's, I think, to Shree's point, a little bit of speed to value. Sometimes hard to sell a grandiose thing that's going to, take a long time and before it bears fruit. But you need wins along the way. And I think if you measure, and this is sometimes a hard thing, and be honest with yourself. Are you really delivering good experience, good service all the time, everywhere? Probably not. If this is a topic for you, because if it is, you've already won. If you're great already, but so there's a lot of things you can do while you're working on some of the broader issues, depending on the company you're in and the role that you're in.
Excellent. All right. One last question before we invite the audience into the discussion. Craig, this one's for you. So what are the outcomes you are seeing, and maybe what you expect to see as well, as a result of investing in and delivering better patient experience?
Yeah, when I've talked to different companies starting this journey and leaders, first of all, you cannot show up to your management, your CFO, and say, patient experience is the right thing to do, and not have an economic story with it. It's just unrealistic to expect that to fly. And so you have to tie it back to what the company's objectives are, depending again on the scale of the initiative. When it works, and I think Chris had some nice, interesting stats there, you're now a high-performing, patient-centered, patient experience-centered organization. And that is going to lead to growth, better brand strength, a better environment to work in, easier to recruit. And if you're in value-based care contracts, because you get paid for a series of metrics that tie directly to patient experience, including things like Net Promoter Score directly. And so, I think that's, at some point you got to translate this to company value, not just patient value or provider value, or depending on the organization, you might not get the kind of sustained support that you need.
Yeah, I would wholeheartedly echo that, right? I think as you're defining the strategy, being able to build a business case and an economic value proposition is very critical. And you can tie that value to different things, right? It's growth, it's improving outcomes, it's driving efficiency, but that setting that up front is actually going to essentially give the momentum for the program, right? Without that, it's really difficult.
Yeah, I mean, if you look at what Gartner says, again, I'm just quoting them, what's coming back from conferences and stuff. So, but they talk about going from like a product-centric or a product-centric approach to a customer-centric approach, getting a 14% lift, which is kind of board level results. We actually see greater than that. We're seeing 20 to 25% lift on certain areas on the revenue side. We see 30 times the compression time, like reducing the time to insight to value by 30 times. So that's an operational efficiency gain. So there's a lot of value that can become, we have, care gap closures that get closed in a much faster pace so that you're getting those bonus payments and you're not stressing by the end of the year. So we've had a lot of success with the results here. But as Craig and Shree said, you're going to have to measure everything, or else these projects are not going to get off the ground.
Excellent. So we're now going to move on to the Q&A portion of the session. So audience members can submit questions using the text box to the left of their screens. And we have a few questions, really great questions to start off with. First one, Chris, it's on a comment you made about the patient experience. And it's about how is technology helping providers deliver better patient experiences, and what are some of the example problems and use cases. I'm curious too, to add to that, is the EHR, is the current technology in the hands of providers able to do this and to do this at scale, or does it require like additional technology?
Well, I think I talked about earlier, if you just listen to Gartner, not me, I'm self-serving if I say you need a different, I mean, you don't always need to throw technology at it, but from a Gartner perspective, if you're doing customer transformation and you want to have patient and customer experience get lift, then then you do need to have certain capabilities, right? And you have to know all that's knowable about your patient, and you have to have a deep progressive patient profile, right? And then from there, that then allows you to open up kind of advanced use cases to be real hyper personalize the patient journey. You can hyper personalize the acquisition process. We have clients that do things, everything from taking all the intent data, the anonymous data from the web, coming into their website, take that intent data, and then from the time, and they start personalizing off of the anonymous state. And then once you raise your hand and you become a patient, they're able to take all that rich, intent data and then activate that and patient journeys, right? So they know what type of content you're looking for, what type of content you'll consume. They'll know the channels that you're looking for, and they'll know roughly what your conditions are based upon what you've been doing in a search standpoint. So that's one scenario. Other scenarios are that we have clients like Craig that are personalizing every single channel with individual content based on they have multiple health plans that come into a single provider. So being able to do that operational efficiency where you're matching doctors to the right time with availability appointments based upon the health condition, and then you're speaking in their languages, and if they're Cuban, you get them a Cuban language. If they're Venezuelan, you put it in a Venezuelan dialect. So that's what hyper personalization is. It's being able to connect with the individual in such a way that they adhere or they follow the plan that you have for them. So those are some examples that we have. We have building block examples where we're bringing together multiple EMR systems because a lot of these health plans grew through acquisition. And even when you don't grow through acquisition, you have multiple silos within your health system. So now what we're doing is we're breaking down those silos and we're elevating that reporting up to management and BI dashboards so they can start to see where their problem issues are. I think both Sri and Craig talked about, you have to identify the problem before you can address it. So there are a lot of scenarios that we're doing in various areas that are driving towards a better patient experience.
Yeah, Kyle, I would just add to what Chris said, right? And this is your second part of your question in terms of the role of the EHR, right? If you look at how the technology has evolved, right? I kind of like to think that in terms of three waves of digitization, right? The first wave was around ERP systems that digitized a lot of the back office. Then you had big investments made in the EHR that digitized the workflows in clinical offices and care settings. But these solutions, at least in my mind, they haven't really focused as much on engagement. So when you look at what they are essentially, systems of record. Now that might be a controversial statement to say, but I think in essence, that's what they are, right? And so the two other investments that you're going to need are in systems of insight. Like how are you going to take that data and build the right insight and enrich that data? Like an EHR has a lot of clinical data. How do you enrich it with other data sets and then build a system of insight that gives you the right insight? And then how do you leverage that insight to build systems of engagement and then do that in a platform-centric way so that you're not creating fragmentation, right? I think that's where the investments are going to be is, systems of insight and system of engagement, because unfortunately, right, most of the investments that have occurred so far haven't really moved the needle on engagement overall.
Yeah, I agree with that too. We kind of view the EHR systems as really good clinical records, good clinical systems. But when you're talking about engaging with someone digitally, you're not going to put their their device IDs, multiple device IDs in an EHR. You're not going to put everything that they clicked on from a contents perspective. You're not going to, all that rich consumer data. That would make it very complex for doctors and hospitals to try to understand what to do. So we agree with Sri's point. You have to have separate data and analytics environments where the EHR and the clinical data is one aspect of the data that you're trying to leverage when you're doing engagement.
Excellent. Some really good questions to choose from here. I'm gonna choose this one though. How do you guys see the proliferation of real world data and real world evidence impacting personalization? I think obviously there's a lot of data out there, guys, and we obviously want to have that 360-degree view. As we get more and more data, I imagine the challenge is going to be significant to make sure we mine that data and turn it into something actionable. So I'm curious, I don't know who wants to take a stab at this first.
I'll do it real quick. So I think what happens is once you start to get, the data hairball, right, where you have all this data coming in and you have all this other data that maybe is not used. What we talk about is you want to have a single source of truth, but at the same time, you want to aggregate that data in a way that is meaningful to each individual, that is coming in to consume from that single source of truth. And so I think what the way to answer that question is, the folks that are going to be leveraging the consumer type data and to do engagement, they're going to need an aggregation of a very deep, progressive consumer type intent data, whatever that is, right? And then I think on the operational side, there's going to be a different record that rolls up, and it could be what Craig says around surveys and results and how the performance is at the last mile. Craig had an example one time where they surveyed their patients, and that they had a 70% preference for female doctors, and they were getting ready to send a campaign out with a bunch of pictures of male doctors. Well, they switched out that image from a male to female doctors, and guess what? They got a 70% lift on the response rate. So that's it's a simple thing, but that we see those type of things right now. When you talk about food insecurity and some of these other social determinants and access to care, and you start to get your ecosystem partners of data. Now what you may want to do is you may want to start looking at data clean rooms, and that's kind of a long-term subject. I don't want to muddy the waters, but that's another way where you can start to share data in a way that's meaningful to second parties. So I'll stop there. Craig, did you have something you wanted to?
Well, I was just going to try to, I was going to leverage off the real world part of the question because I always find that's the great equalizer. You have to be able to think about this stuff in the real world. In a simple way, I think about it is, if you go back to the strengthen the doctor-patient relationship, and I think both Chris and Sri mentioned this, but imagine first, everything there is to know about the patient. And you have all that data lined up, enriched, normalized, processed so you can use it. But a lot of stuff. Then everything about the provider. And everything about the facility, services, operating hours, things like that. And then if you had analytics to match the patient to the provider, even just starting with availability, and they provide the services that you need, and they're in your neighborhood and they have appointments. Just that is massive to do. But now you're starting to see, and then the last piece is the measurement and the improvement. You're starting to see how you can take all the data that's available from all the different sources and put it together in a kind of an operating loop that allows you to do some very, very interesting things that not just matches what the patient needs. That's obviously first importance, particularly in a consumer experience seminar, but also what the provider business needs. Certain doctors specialize in certain types of patients. They prefer, different kinds of things going on, and they're better at it. Language of preference is a simple thing. Things like that are simple and obvious, common sense, which is I like the real world piece. But you know what they say about common sense? It's not all that common sometimes, and it doesn't mean it's easy. But that's why, if you can work with the data, which is the hard part, then you can start to unlock value in a lot of different ways. in the real world.
Excellent. Excellent. Let's try to squeeze in one more question here, guys, because I know we're coming up on time. But do you have any examples of of organizations in the healthcare industry that you're starting to see emerge as leaders in customer experience?
I'll take a quick first start, and I won't name specific companies, but something that seems to be a recurring theme, which kind of makes sense. Two things seem to give companies an advantage. One, if they have the luxury of specializing, if they're serving a targeted segment, like, hey, I just do Medicare, or I just do, young people, or, because then you can put everything specifically to meet the needs of that particular segment. If you're a hospital system or health insurance plan or a big provider group, you're serving a wide range of people. The other thing that I've seen in the trend is if you're a good value-based care performer, then you have more capital, and then you plow some of that capital back into resources and technology and so forth. And it's a kind of a self-perpetuating, you perform, you get paid more, you invest more, you perform better. And companies that are stuck in the old and don't have the capital to do it, they don't move the needle too much.
Yeah, I would agree. And just to add to that, to me, when I think about that question, first of all, I would say within healthcare, and as you compare it to other industries, I think healthcare is a bit more nascent when it comes to driving, a consumer-centric agenda. Having said that, I think the learnings that we can take from retail and other players are being able to really, tap into that relationship with the patient and consumer where they are, right? And whether you're addressing a younger demographic that prefers to see most of their appointments virtually, or they are really, only wanting to book appointments online and don't want to pick up the phone and call, but you also need to serve a demographic that actually prefers to do that. So that's why omni-channel accessibility is important. So consumer transformation, patient transformation doesn't mean everything is digital. I think it's multiple channels of accessibility that you have to address, and then you're really meeting the patient based on what their needs are. Is the best way I can think about it, right? Based on what their needs are, you're meeting them where they are, and if you can do that, and you can do that in an integrated way, then I think you can capture that mind share and you can be more consumer centric.
Yeah, and I think for us, we saw that initially with the ACA get into full effect in 2014, that the payers started to kind of invest in this, B2C data and analytics environment. And then once we, signed up, tens of millions of new, people that never had health insurance before, and they started using the health system, then some of the larger provider systems started saying, whoa, we really need to invest in this data and analytics environment too. So it started out with the larger systems that had, like to Craig's point, that had the funding, that had the finances. And really, quite frankly, they also had the people to be able to run these kind of programs, right? And so, but now, and it's been a really amazing thing in the last 3 years, we're seeing a lot of, not the multi-state, just even single state health systems are now are getting into this right now. And with the really push again with value-based care, we're seeing payers and providers try to work together in new ways over and over again, because there's always been friction there. So now, that's why Craig's company, Lucerna Health, got created, was to fill the gap between the payer and provider, and with services and capabilities that just aren't there. So we see small, not small, but mid-size, and then the large ones that have taken in. But and then I would say, oddly enough, life sciences and pharma are really behind. I mean, they're behind the payers and the providers at this point, although we're having many conversations, so they're trying to catch up, especially with therapeutics in there. But that's kind of what we've seen. It started out with kind of the large payers that when you knew they wanted to take advantage of the individual market, and then from there it really turned into a provider, case by case, whether you had the scale, you had the funding, and you had the people.
Excellent. Well, that concludes our session, guys. Thanks for a really, really spirited discussion for this past hour. So a special thanks to Sri, to Craig, to Chris, to our audience, and our sponsor, Redpoint Global. Thank you for attending this session. Please note we have additional sessions scheduled for this virtual summit. You can see an agenda and register for these upcoming sessions by clicking the link in the resource list. From the team at the Payer Provider Virtual Summit and Excelligent Healthcare Media, take care, be good, and see you soon.
All right, thank you.
Thank you all. Thank you.